Hi, I'm Les Meadowcroft with VetOvation. This is the VetOvation SimpleScope. It's very easy to use and has been borrowed from the human side of medicine. On the human side, it would be considered a bronchoscope and disposable. It is in your veterinary DNA to make this a reusable scope, and it will enable you to put your eyes in a variety of different places. So it comes in a couple of different sizes. This is a 3.2 millimeter outer diameter scope with a working channel that you can use a biopsy instrument through, a cytology brush, or a snare. It also comes in a larger size, 6 millimeter outer diameter scope that you can also use a brush, a rat tooth grasper, a snare through. In veterinary medicine, you will use this scope as a rhinoscope going in the mouth, around the soft palate, and into the nasopharynx, where you can run a biopsy instrument or fluids. You will use it as a bronchoscope as it was designed and run a brush through it to get cytology. You'll also be able to run oxygen or air through this. If you are performing cystoscopy, you will go down the urethra of either a male or a female patient into the bladder, being able to look at and identify the ureteral orifices and make sure that they're working appropriately, along with biopsying the tissue or pulling out a small stone. It's very, very easy to use. Has a handle here which enables you to retroflex the scope one way or the other, and then a dial here that enables you to rotate that scope back or forth. A working channel here enables you to hook up an IV bag to the side of this and run fluids through it. The attachment here, you can hook up air or you can hook up oxygen to that. To give oxygen or air during the procedure, you'll press the button, enabling you to distend the stomach if you're working in the stomach, or run the fluids into the bladder to be able to distend that. During your exam, you may want to be able to take pictures or video, and that will be done through the button there. Very easy to use system. The processor comes either in a standalone processor or with a monitor attached to the processor. So think of the size of this unit similar to an iPad. Basically turn the system on. If you're using the system that doesn't have the monitor attached to it, you'll want to attach this to your medical grade monitor. The monitor is telling you attach the instrument. You'll have the green arrow up, and then this plugs in directly to here, and then your image comes up. Just like you would do with any scope, you're always going to want to white balance your scope. So take a gauze, look at the gauze, and depress the AWB button on your screen. That will white balance your scope so that you can now start the scoping process. I would hold this handle like this so that your thumb is up, and now you can retroflex your scope one way or the other. If you had an assistant driving the scope, you would also have the ability to rotate the shaft back or forth. All pictures and video that are taken during the procedure are done from the button there, and those will be saved onto an SD card. Traditionally, small flexible scopes such as this in the human space were very, very expensive. VetOvation has introduced a SimpleScope that is semi-reusable. So if your scope becomes damaged, if the patient bites down on it, or if it becomes damaged in any way, the replacement cost for this scope is very low. Please contact VetOvation or your Patterson representative to get additional information on the VetOvation SimpleScope system.